Hi there. I am Dr. Susie Houston. I am with ECU Health Lifestyle Medicine Clinic, and I am here to talk about diabetes meets lifestyle medicine. And this is the February check in. And thank you so much to Akila for inviting me back so that I can share some great information about a chronic condition that impacts many people in Eastern North Carolina. And if you don't have diabetes, then you may certainly know somebody in your family or a friend that has diabetes, and this might help them out. So it's just a few words. I'm going to take up a little bit of your time just to share some information and some resources and community events that are happening close to home in our Greenville area. So just a little FYI, and oopsie, a little line change. But so I am a doctor of nursing practice. That's where I get the Dr. Susie Houston. I'm not a physician. I'm not a medical doctor. I'm a doctor of nursing practice. Went to graduate school to become an adult gerontology nurse practitioner, and I'm board certified in that. I'm also certified diabetes education or diabetes care and education specialist. I have a bachelor of nursing science, and also I'm a registered nurse. An added bonus is I was a chef before I ever thought about becoming a nurse, and I'm also a person with diabetes. So I've been living with diabetes for years. I maybe did some right things, some wrong things, but it's got me to where I'm at today. And especially if there's a few words, if you know me, you know that I have a few words that I'm just not keen on. One is non compliant. Don't really like that word, don't like it used. And I barely comes out of my mouth unless I'm giving a little lesson. Also, don't like the word diet just because nobody stays on them. And another kind of pet peeve word is using the word diabetic. So nobody likes to be called cancer or your hypertension or you're diabetic. So we are people with diabetes. We've got this condition, but we are utmost living our best life ever and managing diabetes, not letting it manage us. So that's just a little FYI where I get all my initials and what they mean. And then we're going to move on. So, diabetes prevention and management at ECU Health Lifestyle Medicine Clinic. I hope you know where we are and how you get connected with us. And if you don't, I'm going to share that in the next few slides. But we have you covered. If you're trying to prevent type 2 diabetes or trying to manage diabetes, that you've just been trying to get an A1C and it's get to goal and you're just not there, we might be able to help you out with our premise is lifestyle medicine, which involves healthy eating, physical activity, managing stress, building and forming relationships, improving your sleep, and avoiding risky substances. And in some cases, that might be your sweet tea or your regular Dr. Pepper, ginger ale. Diabetes doesn't care, and neither do I what soda, but if you could get rid of the sodas, that'd be one less risky substance to avoid and help you on a wellness path. Also, self-care behaviors, because you are the manager of your own health and your diabetes plan. We want to make sure people are coping well, they're eating healthy. On the left-hand side of the screen, they're being active, taking medications, and know what they're for and when to take them. Monitoring, making sure that you are checking your sugar as best you can with your devices that you've got. Also, learning to reduce risks and problem solve. Life has a lot of things going on, and just when we think we have it together, diabetes comes in and, like a tsunami, can bring a few other chronic conditions that make it hard to manage life as we kind of work through it. Also, preventing type 2 diabetes, we have loads of programs that are in our state and across the nation that are geared to help people with maneuvering pre-diabetes or managing to stay away from type 2 diabetes. So just so you know, February is Heart Health Month, and here at our Lifestyle Medicine Clinic, which is at 2610 Stantonsburg Road, we are kind of adjoined with our Wellness Center, but we have our own clinic here. And for Heart Health Month, we had two cooking demonstrations. They were free. Sadly, the one here in Greenville was last Thursday, and there'll be another one. If you want to travel, you could sign up and come and see me in a Hosky, and that's where we'll be doing a heart healthy cooking demonstration. But stay tuned because we will have future events, and I want to make sure that we can share this information with our community so that you could sign up if it works for your schedule. Okay? So don't be sad you missed it, but just be listening out for the next time we have it. And I'll try to make sure that I give you way more notice than this. All right. Just so you know, February is Spark People 28 Days to Healthier Heart, which sounds great because that ties in with our Valentine's Day. Hopefully, everyone got nice flowers or plants for their garden instead of, the usual box of chocolates that we know we shouldn't be eating or couldn't get through all of them, and only adds to stressors about our blood sugar management, our weight, unless, of course, it's dark chocolate eaten in small pieces. But for February 20th, which is where we're at, helping your one of the days for healthier heart, it says catch some z's. So if you average less than 8 hours of sleep at night, you could be putting your heart at risk. So think about changing up your sleep habits, your sleep attitudes, and work on your sleep hygiene. Getting 8 hours of restful sleep, not interrupted, like, oh, what was that, waking up, going to the bathroom, getting a drink, going into the kitchen to get something to eat, watching some TV. So not that kind of night, but trying to get some restful sleep. It's an important part of heart healthy lifestyle. It's also important in decreasing cortisol levels in our body, which also help us decrease maybe weight, which then could also help with type 2 diabetes management. So get your Z's in. That would be the February 20th chat topic. So, ECU Health Lifestyle Medicine Clinic, we go really well together in helping manage diabetes, prediabetes, and preventing diabetes altogether. A few other things that come before prediabetes might be metabolic syndrome. Ooh, I got a touch of sugar, gestational diabetes. These are all things we have to think about. Ooh, I need to start doing some lifestyle medicine changes, change my habits, change my attitude to help make food work as medicine, exercise work as medicine. And these are kind of concepts that tie in with lifestyle medicine and are really important because they could help you be on less medications, which isn't that a great thing? We also help in our clinic on how to improve your eating habits, your mood, your weight, your blood pressure, sugar, cholesterol, even joint pain fits in there when you start thinking of using lifestyle medicine as a new medication in conjunction with what you already take for medicines. So I always think food is medicine and exercise is medicine. They're fantastic. We just don't talk about them enough or how we as each individual could take them on so that we could see results so that perhaps one day we need less medicine, not more medication. So keep that in mind. How could lifestyle medicine in our clinic fit into helping you keep your diabetes or prediabetes under control and you are well managing it, not it managing you? So, with food as medicine, exercise as medicine, lifestyle medicine changes, there really are no side effects. I'm thinking of the side effects you hear about medications we might start, or you see those commercials on TV that it may cause nausea, vomiting, diarrhea, upset stomach, headache, erectile dysfunction, loss of appetite. Well, none of those sound great, right? So just think about lifestyle medicine as a choice or option the next time you're talking with your primary care to see how well you are managing your diabetes, your cholesterol, your weight, your blood pressure, and just maybe think maybe you could get a referral or you can call us. And I'm going to say the number a couple of times, and it's 252-847-9908, so that you could get connected. And you might maybe need a visit with a registered dietitian. That's what RD stands for. Might be that you're having trouble coping with chronic conditions and coping with some life events or things that are happening in your world. And maybe you need to speak with a counselor regarding lifestyle medicine. But sometimes we have to speak with a counselor first before we even think about adding broccoli to our grocery list. So think about that. I am one of the full time providers here. And remember, I told you what I am. I'm a doctor of nursing practice. So I'm an adult gerontology nurse practitioner, and I'm also certified diabetes care and education specialist that might be able to help you out. We also have a lifestyle medicine provider and a healthy weight provider. So you've got choices and options when you call. So 10 warning signs of diabetes, just in case you're wondering. Number one, you might have increased urination, Glucose in water, dehydration, they might be interfering with daily life, going to the bathroom a lot. So you might want to think, oh, could this be diabetes? Another one to think about, increased thirst, like just all the time. You're thirsty, thirsty. You could drink anything. You see a bottle, go, go, go. So that might be an indicator. Unintentional weight loss. You've got elevated sugar, but it is not going in the cells, which means you drink or eat more, and the calories are getting sent into the toilet because your body is trying to balance out the sugars. You might have increased fatigue for no apparent reason. So, sleepy, tired, thirsty, thirsty, going to the bathroom, and you're losing weight and you're eating a lot because your cells need fuel and it's not going in the right spot. You might have some blurred vision, frequent yeast or urine infections, poor wound healing. You might be having some sores that aren't healing. Skin changes. It might be that you're getting dry, itchy. They call it acanthosis nigricans, but it's really darkened patches. If you have dark patches around your elbows, around your neck, around your knees, maybe your armpits, this might be an indicator that you are at risk for type 2 diabetes. Also, tingling feet and hands, this might be a pre-indicator, precursor that you're on your way to type 2 diabetes, or it's there, it's knocking at your door, because you might have peripheral neuropathy. So these are the warning signs, and it's trying to put those all together. Like, you know your body better than anyone. So think through those, and if you do have a few of these, you might want to get an appointment with your primary care provider so that you can ask about getting an A1C and a glucose checked just to make sure that your numbers are in good shape, okay? Also, risk factors for type 2 diabetes. Uh, Age, so being over 45, that puts us at risk. Our background, our ethnic background, if we're African American, Latino, Native American, seems to be a higher risk in those ethnic backgrounds. If you're obese, so you're carrying, especially if you're carrying it around your middle, that puts you at higher risk. If when you were pregnant you had gestational diabetes, that puts you at risk and you need to do something about it. If you're still carrying around the baby fat from your son that's now 23, 24, it needs to go, needs to be thought about, because the gestational diabetes is kind of your wake up call and signal to say, hey, I better do something different. If you've got a family history like your mother, father, sister, brother, you're at risk. And then if you have PCOS, polycystic ovarian syndrome, if you've been diagnosed with that, you could be at high risk for type 2 diabetes or pre-diabetes before you get type 2 diabetes. So ask about screening with your primary care when the next time you see them. Also ask if you've ever had an A1C or a glucose check and what were your numbers. You might want to write them down so that you know, oh yeah, okay, last year I was this, and now this year I'm creeping up. I should really do something about it. It's your wake up call. So let's go. All right. So, what is our diabetes prevention program? It's a CDC recognized program using a P Prevent T2 curriculum, and it is guided to help make teeny tiny lifestyle changes that can delay or prevent type 2 diabetes. So, imagine if lifestyle changes could prevent type 2 diabetes. How awesome is that? So, it is a 1 year program. There's weekly meetings times, and each program that you might get registered with or find out about, they may line up the meetings a little differently, but what we've done in the past, it was weekly 16 weeks and every other week for 2 months, and then monthly for 6 months. There are group formats, and there it is group format. There are virtual, there are face to face, there are variety. The main goal of the program to think about is losing 4 to 7% of your weight, decrease your A1C, and increase your physical activity. So to 150 minutes a week. And so diabetes prevention programs across the state, they are free. You just got to find them. The biggest cost is your time. It's about an hour for 26 sessions. So that's 26 hours over the course of a year to stop, prevent, or delay type 2 diabetes. How cool is that? You just need to know where to check in for it. So pre-diabetes, this is, think of the risk of shark attack, but mind you, with drones and all sorts of social media, we find this number is probably going to go up because us keep seeing those sharks everywhere in the social media. And even I hate those ones where there you are minding your own business, swimming away, and a drone's over top of you, and 6 sharks are around you, but the poor little person on their little dinghy doesn't know anything about it. So always beware, I think. Swimmer beware, buyer beware. People across the globe need to be aware that prediabetes is really on the rise, sadly, and 1 in 3 adults probably is at risk for it. So that's a big deal. So to be eligible for this free program, now this might not be for you, but you can definitely share this message forward to help family members, friends, church family, your neighbor, people you work with, so that they know about the program. So, one of the eligibility criteria is an elevated A1C. So, to be eligible for the program, you need to be in this orange zone, which is prediabetes. So, your A1C needs to be 5.7 to 6.4. That's prediabetes. Your fasting sugar could be between 100 and 125. That's a prediabetes indicator. Or a random, or they call it glucose tolerance test, would be a blood sugar between 140 and 199. That would fit. Also, gestational diabetes, that's another criteria. So if you were pregnant and you had diabetes, that would put you eligible for the program. Or you scored 5 or above on the prediabetes risk test. Now, if you've been on here before when I've been last year, you could probably say these questions, oh, sorry about that, but I've got it over some important information, but I'll fix that for next time. So I just want to remind you, Diabetes Alert Day is always the fourth Tuesday of the year in March. So March 28th, please, please, please help us spread the word. Share the prediabetes list diabetes risk test to help friends, family, and stop or delay type 2 diabetes. And so this is the risk test. How old are you? If you have 5 fingers held up by the time I finish these questions, you might want to be going online to diabetesfreenc.com to find out where there's classes or programs for DPP, they call it for short, close to you or online. The uh, Eat Smart Move More program, they have it ongoing. It's just continues to run and it's all virtual and online. So there's another resource, but I'll make sure we have this next time. But let's go through the quiz. How old are you? So if you're 40 or less, that's 0 points. Yay for you. If you're 40 to 49, 1 point. 50 to 59, 2 points. 60 or plus, you get 3 points. If you're a guy, you're going to get a point. If you're a lady, 0 points. Yay, ladies. If you're a woman who had gestational diabetes when you were pregnant, you get a point. So remember, that's an indicator and a reminder. Do you have a mother, father, sister, or brother with diabetes? You get a point. If you've ever been diagnosed with high blood pressure, you get a point. Are you physically active? So that is meaning non-couch potato people that you're getting at least 150 minutes of physical activity a week in. So if you're not, you get a point. If you are, yay you, keep it going, okay? Then what is your weight category? So if anyone has told you that you're overweight, you'll probably get a point. If they've told you that you are obese, you probably get 2 points. And if you are considered morbidly obese with a BMI greater than I think it's 30 or 40, you get 3 points. So if you've got 5 points right now up in the air, that means you're at risk for prediabetes. And if you're at risk for prediabetes, that means you're at risk for type 2 diabetes. So you want to stop that in the tracks. So you could call our number to find out more, and that's the 252-847-9908, or go online to www.diabetesfreenc.com to find out more information about the diabetes prevention programs in North Carolina. So here we are with ECU Health. We've got one-on-one provider visits in addition to your primary care. So to see a provider in our clinic, you do have to have a primary care. You can get referred by your primary care, which would also help us spread the word about what we can do to help manage chronic conditions along with your primary care provider. We have dietitian visits, that's RD, registered dietitians. We have lifestyle coaching, and our lifestyle coaches are registered nurses and also exercise physiologists. And that segues into our exercises medicine program. And that is a 8-week program where you meet with an exercise physiologist to develop your strengths of working out. And so if you've got some medical conditions that are hampering or stopping you from any physical activity, you might need to call us and find out if we have a scholarship or what our program is all about to help you. You would need a referral from your primary care provider to get started with that, but it doesn't hurt to call today. We also have cooking demonstrations, like I mentioned before. And in the future, we will restart our cooking with diabetes classes that ties in lifestyle medicine to the diabetes self care management behaviors to help people be best manager of their diabetes and health plan ever. So, for people that are interested in making lifestyle medicine changes that can help blood pressure, cholesterol, diabetes, and their weight and feel good, contact us at 847-9908. Your health and well-being, it's really important to us, and working on these lifestyle medicine activities with little side effects but good health and feeling better and joint mobility and flexibility can only help. And these are what I had mentioned earlier, the healthful eating. We do focus and try to inform people about whole plant-based foods so that we are letting food work as medicine and that we are staying further away from processed foods and fast food places because they really, I guess, are almost geared to helping us build our chronic condition numbers. Because they impact our weight, which then that impacts type 2 diabetes, our blood pressure, and then our cholesterol. And it turns out there's a bunch of medications for all those chronic conditions. So, working on healthful eating and being mindful, physical activity, stepping up your game as best you can where you live without being too expensive. Managing stress, super important. Forming and maintaining relationships, like the people that are in our little posse, are really important. And then just keep in mind, some people can drag us down in life, and then others can lift us up. So trying to get more of the uplifting folks in your little part of the bubble would be very helpful. It may even help you with your stress management, may even help you with sleep, and then avoiding risky substances. The flat part out is if you smoke, stop. If you drink, make sure it's in moderation, which is 1 to 2 drinks a few nights a week. And if you drink sweet drinks, again, like the smoking, stop. That's all I can say. Stop. Stop the sweet drink, stop the smoking. All right, this is somehow my little slides didn't work out great, but I have started the diabetes sweet talking monthly diabetes support chat, which was like takeoff of the support group. It is going to meet monthly on, I want to say it's the third Wednesday. It'll be from 12 our class will open at 12 p.m., but we'll start at 12:15. It goes for 45 or 50. Oh my gosh, 30 minutes. My gosh. It goes for 30 minutes. So if you are in Greenville, please feel free to stop by. There's no charge. And it's really, the lunch is not offered because it's such a short period, but it's just a time to sit in. So if it is you need lunch, make sure you get it before you come or eat it, or just plan breakfast so that you can have lunch right after we're done. It goes by quick because our last talk we had was Heart Health ABCs, and it went by so quick that it was over before we knew it, and we just had a good time having a chat there. And so far, our numbers have gone from 2 to 5, so we are building. So feel free to stop by. It is at the ECU Health Lifestyle Medicine Clinic classroom, which is inside the Wellness Center on Stantonsburg Road, 2610 Stantonsburg Road. And I do apologize about this slide. It's a little bit mixed up. Also, I want to let you know about the Winning with Diabetes program that is coming up. It is going to be March 25th from 8:30 to 3 p.m. There is still time to join and sign up. It does cost $10. We do want everyone to register by March 17th, just so we have a head count. The cost is $10 because you get a lovely lunch that we provide. We provide from one of our local establishments, and we also help you with managing and figuring out carbohydrate counting so that you know what you're getting there. Please make sure you can use this barcode, or you could go to this web link, or you could call this number, 252-847-4149. Okay, that's Winning with Diabetes. And this year we've got the theme of a boot camp because we just know there's so much to do with diabetes that it is as if you had to go to a day-long boot camp to get some information. But we have great speakers in the morning, the lunch is in the midday, and then we have screenings and experts in the afternoon to help you out. If you or someone you know has diabetes and want to learn more to manage it and get it under control, make sure you reach out to our 252-847-9908 so that I can add you to the monthly diabetes support reminder and also include you in the websites for these in case you missed them. Oh my gosh, my slides are terrible this time. Don't forget to drink your water. Make sure you hydrate every day, all 365 days of the year, and all the seasons of the year. Okay? No time off for water. And the best thing about it, no calories, so you get to eat a sandwich or enjoy, right? Until next time, I'm Dr. Susie Houston from ECU Health Lifestyle Medicine Clinic. Thanks so much for joining. And just think about if you're interested in learning more about diabetes prevention, diabetes care, management, lifestyle medicine services, lowering your blood sugar, blood pressure, cholesterol, or weight, call our number at 252-847-9908. Thanks so much. Take care and have a healthy day.